All right, everybody, I have the top of the hour. I know a lot of you are still joining, but we're so excited that you're here today. We have a full hour's worth of awesome information to send your way. So we are going to go ahead and get started. A couple housekeeping things. This is being recorded, and you will get the recording and a PDF of the slides after the presentation today. So you'll get all of that. We have several videos that we'll be playing. So we'll be taking our videos off for the majority of the presentation, but we'll turn them back on at the end. Feel free to ask questions as we go throughout using the Q&A box. A lot of times your questions may get answered, but I want you to remember what your question is. So I don't want you to like hold it in and forget about it at the end. So go ahead and put your questions in the Q&A box. And then we'll make sure we answer those at the end. So we'll go ahead and get started. But before we really dive in, I would love for Dr. Bender and Monica to please introduce yourself and feel free to say a few words.
So hi, everyone. I think most of you probably know me. I'm Kay Bender. I'm the Executive Director of the Mississippi Public Health Association, and also this year the President of the American Public Health Association. But more importantly for this audience, I'm an old labor and delivery NICU nurse and started my career in public health in maternal child health. So this whole topic is a longstanding nursing public health issue for me personally. And the Mississippi Public Health Association has been a partner with the Mississippi Perinatal Quality Collaborative for several years for various initiatives aimed at improving the health of our mothers and babies. And so I am so excited about the Count the Kicks program because it just, the stuff I've reviewed, it just seems very logical, very easy, and so important to helping us reduce or better eliminate our stillborn birth rate in the state. So thank you to the Count the Kicks team and to my good friend Monica Stinson with MSPQC for including us in this. And I look forward to not only this webinar, but our future work together. One more thing real quick, Nick, and I want to make everybody aware, we did release a press release last week about this program, and so far we haven't had any press inquiries, but I'm happy to send those of you who are on this call, on this webinar, a copy of that. I'll put my email address in the Q&A box, and so if any of you want a copy of that to share locally, or even in your organization, all you have to do is ask. So with that, I'm going to be quiet so Monica can come in, and then I look forward to the webinar. Thank you, guys.
Thank you.
Good morning, everyone. My name is Monica Stinson, and I'm with the Mississippi State Department of Health. Also, I serve as the program manager for the Mississippi Perinatal Quality Collaborative. I just wanted to welcome each of you here this morning. We are so glad for, I think I see 72 participants on so far. I'm just really excited for this partnership with Count the Kicks and Mississippi Public Health Association. We look forward to working with all of you on the call by helping to get resources out and hope that you learn a lot from this webinar today on what the program is, this educational campaign. And please spread the word, because we are trying to save babies, we're trying to save lives. And so we just want to create a healthier Mississippi. And we know that we cannot do it alone. We have to work with partners and work with our community to do this. So again, thank you. I won't take up too much time, but thank you. As Dr. Bender said, thank you to the Count the Kicks team. You guys are so wonderful. And our Mississippi ambassadors here, I don't want to forget to acknowledge them. And we just look forward to this wonderful partnership. Thank you.
Awesome. Thank you, Monica and Dr. Bender. We really appreciate that. And I echo everything you said. Thanks to this awesome partnership with you all that we are able to launch Count the Kicks statewide. Dr. Bender, I can absolutely send out the press release to everybody that's registered as well. So I can go ahead and do that, not a problem. So with that, we'll go ahead and jump right in and get started with some other brief introductions. And so obviously, you know me, I'm Megan Ockett. I'm the program director with Healthy Birthday, which is the nonprofit organization that created Count the Kicks, which is the stillbirth prevention education campaign that we're talking about today. My background is in public health. I have close to 15 years experience in public health. I used to work for the Iowa Department of Public Health and Tobacco Prevention and Control. But my true passion is maternal and child health, and specifically around systems level change. How can we integrate Count the Kicks into your workflow so it's easy to talk about, it's easy to remember, and everybody's doing it? It should take 3 to 5 minutes. And so we're going to give you the tools and resources today on how to talk about stillbirth and stillbirth prevention with your patients and clients. So I'm super excited to be here today. And with that, I'll throw it over to Grace.
Hello, I am Grace Green, and I am a Mississippi ambassador. I have been an ambassador for about 2 years. I'm a mom of 4. I'm a doula and childbirth educator, and I'll share a little bit more of my story and how I got involved with Count the Kicks later on in the presentation.
Thank you. Caitlin.
Excuse me, I'm Caitlin Ramage. I am a Mississippi ambassador. I live in Oxford, and I am working in honor of my son, Carson. He is the middle of our 3 boys. He would be 2, but he was stillborn at 34 weeks due to an undiagnosed clotting disorder. So I'll tell more of our story throughout, but yeah, I'm working in his honor.
Thank you, Caitlin. Thank you, Grace. So before we dive right in, one of the first things we like to do is share a video with you all. And we share this video for a couple of reasons. One, it's a feel-good story. It's about Baby Save Ruby. When you walk away today, you're going to remember baby Ruby and you're going to remember baby Nala, who we'll share at the end. But 2, it does a really good job of showing you how the Count the Kicks campaign works and how the app works. So if you're not that familiar with it, it does a really good job in a brief 2-minute overview of how to use the app and why it's so important. And then third, we also might reference a couple of things from this video throughout the presentation today. And finally, it goes to show you the power of that storytelling, that mom to mom storytelling. When this aired on Good Morning America in 2017, we saw a 3,700% increase in our app downloads. It went through the roof, and it was all because this story aired. So whenever you have an opportunity to share a story like this, to share one of our YouTube videos with your expectant parents, please do so, because this is what they're going to remember. They're going to remember baby Ruby, and they're going to know that her mom counted kicks, spoke up to her provider, and now baby Ruby's here because of it. So this is why we want to share this video. So let's go ahead and watch. I will share with you, it's slightly delayed, but you should still be able to hear it just fine.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
Oh, nice.
life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
That's exactly. I love that little baby stretch at the end. Caitlin.
So what is Count the Kicks? So this is an evidence-based stillbirth prevention public health campaign. I think the evidence-based part is really important. And it is an early warning system for expectant parents. Now, this was started by 5 stillbirth moms in Iowa, well, stillbirth and infant loss, and it's based on a Norway study that reduced stillbirth by 30% through this educating on monitoring fetal movement. And the same sort of reduction in stillbirth has been seen in Iowa as well. So this campaign really educates birthing people on the importance of tracking fetal movement. We have a free mobile app, and then we also have paper charts. So if you have patients who are living in a rural area and don't have good internet access, or if they don't have a smartphone, or maybe you just have people who prefer paper, we have both options available. This really empowers expectant parents to speak up to providers if there is a concern, and it gives you both data that you can look at so that you can speak the same language about what's going on with the baby. And 1 in 3 at-risk babies can be saved with Count the Kicks.
As we're looking at the definitions and facts, most of you probably know this, but a miscarriage is defined as a loss of a baby before the 20th week of pregnancy, and stillbirth is defined as a loss of a baby after 20 weeks of pregnancy. And then there's either early, late, or term stillbirth, with early being between 20 to 27 weeks of pregnancy. A late stillbirth is 28 to 36 weeks, and then a term stillbirth is 37 or more weeks. And on average in the US, 23,500 babies are born still every year. That is 65 babies a day that are born still in the United States. And infant mortality is the death of an infant before his or her first birthday. And we hear a lot about this, but on average, around 22,000 infants die every year in the US. So our stillbirth rate, we actually lose more babies to stillbirth than infant mortality. And so those are some of the stats and the definitions. And then these are some of the causes of stillbirth. They can be most likely it's due to pregnancy and labor complications or problems with the placenta. Can sometimes be caused by birth defects or an infection that the mother has. Sometimes it can be problems with the umbilical cord or other medical complications in the mother. And you can find more about those causes in the link here. We're going to talk more today about preventing stillbirth, but if you're interested in learning more about the causes of stillbirth, you can find it here on the link with the study. And then there are, these are some of the stillbirth numbers. The national data shows unacceptable disparities. 1 in every 169 pregnancies in the United States ends in stillbirth, but the racial disparities are much higher. Among Black mothers, it is 1 in every 96 pregnancies. Hispanic mothers, it's 1 in every 199. For Indigenous mothers, it's 1 in every 138 pregnancies. For white moms, it's 1 in every 204 pregnancies. And you see that Asian Pacific Islanders is 1 in every 233 pregnancies. And just as we mentioned before, it's just as prevalent as infant mortality. And this was something that really stood out to me as I started learning more about stillbirth, that families are 10 times more likely to lose a baby to stillbirth than to SIDS. And I know, in Mississippi, I see around Jackson those, safe sleep billboards. I hear about it from my pediatrician. I have a my baby, my youngest is now 2 months old. And so, every time gone to the pediatrician, it's on the literature I'm given. It was on the literature I was given when I was dismissed from the hospital, when I was left the hospital. But there's not much talked about stillbirth, even though a family is more likely to experience a loss from stillbirth than they are to SIDS.
Yeah, thanks, Grace, for shining a light on the data. So that was the United States national data. Let's look closer at your data specifically in Mississippi. And I don't think it'll be surprising to anybody that shows that, unfortunately, the stillbirth rate in Mississippi is the highest in the United States at 10.42. That's 10.42 stillbirths per 1,000 live births. That's the 5-year average. 1 out of 106 pregnancies in Mississippi will end in stillbirth. Mississippi is losing approximately 384 babies to stillbirth each year. If we take a look at the race data on that next graph, that it shows that the Black stillbirth rate is 16.18 per 1,000 live births, compared to the white stillbirth rate of 6.12 1,000 live births. Again, even that white stillbirth rate is higher than the national average. This is why this partnership with the Perinatal Care Collaborative and the Public Health Association is so important. This is why this conversation today, this webinar today, is so important and impactful. You are going to change this. You are going to change those numbers together and get them to look more like this. This is our Iowa data. So I talked about earlier how I'm in Iowa, we're based in Iowa, and Caitlin briefly mentioned the founders. And so we were actually founded in 2007, 2008, after some of the founders went to a public health conference in Norway. Or sorry, not in Norway, the public health conference, but the research out of it came from Norway that showed when expectant parents were educated on the importance of tracking fetal movement in the 3rd trimester, among this cohort of pregnant women, the stillbirth rate decreased around 30%. So the founders, hearing this, said to themselves, we can do that. We can bring a stillbirth prevention evidence-based campaign to Iowa. Great things start here. We can do this. And so that's what they did. They worked with Iowa Department of Public Health and some other organizations here, and they created this Count the Kicks, this empowering, bright, colorful campaign that gives you as providers and those working with expectant parents the tools and resources. So from 2008 to 2018, we saw a 32% reduction in the number of stillbirths. And public health officials have said here in Iowa, there was really nothing else going on that would have made such an impact on the stillbirth rate. It's not like smoking decreased, and that's a risk factor. And in fact, that has increased. It's not like obesity, which is a risk factor, has decreased. Again, that has increased. It's not like every expectant parent received doula care, which we know would be phenomenal and would make a great positive impact on birth outcomes. Count the Kicks was what happened. In the first 5 years of the campaign, we saw a 39% reduction in the number of stillbirths among African-American women here. So this is the type of success we want to see in Mississippi, but we need your help. And this is why we're here today. So why are there such large disparities for stillbirth? Well, I don't think it's surprising to anybody. I think what's really important to know and understand is we have to talk about this. We have to get to this point where race is no longer a predictor of stillbirth. And why is that happening? Systemic racism, toxic stress, epigenetics, predisposition to certain conditions that may lead to stillbirth, like gestational diabetes, preeclampsia, or high blood pressure. All are linked to maternal stress, and experts say Black women are less likely than other races to receive early treatment for these conditions. Access to healthcare, socioeconomic barriers. Research shows education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school-educated white woman. So what are we doing at Count the Kicks to reduce disparities that exist and persist in stillbirth? And what can you do? We're working within marginalized communities. We're working outside typical healthcare settings. We have a faith-based initiative. We have a oral health project initiative that we're doing. We have an app in 14 languages. We'll talk about the app in a little bit, but be thinking about if there's a demographic or language that we don't have something in and the tools and resources, let us know, because we want to meet your needs. We want to be inclusive. So making sure we have the culturally appropriate education material. We have health equity coordinator on staff, and we're hiring a director. We're always looking for funding opportunities to reduce racial disparities that persist. And we're an inclusive organization with 100% board and staff trained on anti-oppression and structural racism. We are improving programming based on lived experiences of women of color. We have videos and printed educational materials and FAQs in multiple languages. In Iowa here, we just did a whole campaign within the Burma community where we put out billboards throughout the state in Burmese, the first billboards ever that this community has ever seen with the language on it that they need, Burmese. And so let us know what you need in Mississippi, and we will work so hard to get that done because we're in this together. So we mentioned this a couple times that this is research and evidence-based campaign. And so what I really want to draw your attention to is this research study that you see on your slide here. This is the study that I just talked about with the Norway study among those women, those cohort of women who were educated on the importance of tracking fetal movement, and the stillbirth rate decreased around 30%. If you really like reading journal articles and evidence and things like that, more power to you. That's awesome. We have a whole evidence page on our website that goes through all these different articles about the importance of fetal movement monitoring. If you don't like reading journals that much, that's okay too, but I highly recommend you at least read this one because this is the one that started it all. Dr. Ruth Fretz, she was one of the researchers on this study. She was the only US researcher on this study. She's from Harvard Medical School, and she's also on our medical advisory board. And her quote, one of the quotes that she said here is, tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the 3rd trimester of pregnancy. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern. We're going to say that word a lot, that normal movement pattern, because that's really important, starting at 28 weeks, and to speak up if they notice a change. So again, we have a whole page dedicated to all this evidence and research. So I'll let Grace share a little bit more about this, but know that you can access this all on our website. Go ahead, Grace.
Count the Kicks was named best practice by the Association of Maternal Child Health Programs earlier this year. After a thorough scientific review, the leading maternal health association in the US determined that our program meaningfully engages stakeholders at all levels of practice, ensures improving health equity is an integral component of overall program sustainability, has been extremely validated by another entity, and it's replicated with similar positive results in other contexts. So one of the things we always try to do is have best practices that are backed up by research. Everything that we do is research-based, so you can, like Megan said, go back and read the research, look at that. But this has been validated recently by the Association of Maternal Child Health Programs. You can go on to the next slide.
And this is the CDC Hear Her campaign. You all might have seen this or some aspects of it. As part of the campaign to reduce maternal mortality in the US, the CDC lists 15 urgent warning signs for expectant parents, and the importance of paying attention to baby's movements is one of the key markers. So this just kind of illustrates that we're not the only people who have picked up on this and are talking about it and sharing it. So this just kind of contributes to that external validation of how important this is and how helpful it is. So let's talk a little bit about what I think most people assume is the problem with talking about kit counting, is that there's a concern that this would increase anxiety in pregnant women, or we don't talk about stillbirth because we don't want to scare them. But as someone who had a baby who died, and then I now have a 3rd son as well, I think that I can say that this really decreases anxiety when you think about the fact that moms want to protect their children, right? Like, it doesn't matter if it's the 1st pregnancy or the 10th, that's what we want to do. And this is a concrete way for a mom to feel like she is contributing to the safety of her baby. So you'll see some studies here. So one potential side effect of routine monitoring of fetal movement could be an increase in prenatal visits, either outpatient or in hospital. However, most research has not found this type of increase to be true. Usually the fetal movement count is reassuring to pregnant women and prevents unnecessary visits. And I think with the app or the chart, whichever you use, what it's actually doing for the mom or the pregnant person and the doctor is that it's making that concrete. It's not just, I feel like he moved less yesterday, or I feel like he hasn't been moving as much lately. the pregnant person can look at the data and say, okay, no, I'm not, I don't need to lean into that feeling, because I can see, concretely that yesterday he did 10 kicks in 5 minutes and today he did 10 kicks in 5 minutes. Everything is fine. So you can see there are some studies cited at the bottom of this slide as well. The other thing I really want to impress upon you as someone who has used this app after my baby died is that with my third pregnancy, I'll be honest, there was not a lot that could have been done to make me feel less anxious, because my anxiety was now actually founded in reality. But what was a struggle for me, and what is a struggle for a lot of women after they've gone through a stillbirth, is bonding with the next baby. And so the app really helped me in that way, is that it really made me be intentional about creating time to bond with Mason and get to know him. And I can say, like, of my 3 births, my oldest is 6 years old now. When he was born and we were in the hospital, I remember feeling very disconnected. And then I went on to have postpartum depression with him. When Carson was born, I felt, obviously there was a lot going on, but I felt a little bit more bonded to him because I had done things like we named him earlier, we practiced using his name, things like that. But when Mason was born, I had been so afraid that I would disconnect from him due to the grief and the fear and the anxiety and the hopelessness that I was feeling. This app and some of the other things that I did to really bond with him, when he was born, I felt like I had known him forever. And that was really healing and really special. And so that's another aspect to this app that is just as valuable as actually the kick counts and monitoring the baby and their safety. It's also creating an opportunity for mom to bond with the baby.
Great.
Okay, some additional benefits to fetal monitoring include a reduction of the preterm birth rate, because often you can, if moms notice a reduction in movement, and they can go in, and if there's an issue related to if preterm labor, it can often be stopped. This is actually this scenario occurred with our executive director, and they were able to stop the preterm labor. Fetal growth restrictions can be identified earlier, because often you'll notice a reduction in fetal movement, or it will be not as strong. And so you can identify a fetal growth restriction, which is also a risk factor for stillbirth. And then women who have stillbirths are at a substantially higher risk for severe maternal morbidity than women who have live births, regardless of the cause of fetal death. And so by reducing stillbirths, we can also protect women from these from the severe maternal morbidity as we are reducing the stillbirth rate. Because due to the low cost and potential benefit, it is recommended decreased fetal movement can indicate a need for more evaluation and has the potential to save lives.
So just like Grace just said about that connection between stillbirth and maternal mortality and morbidity, that is a real fact. And we actually just released a white paper about that, that you can access on our website. I will go ahead and attach it to or send you a link during the post-webinar email. But this was titled "The Link Between Stillbirth and Maternal Mortality and Morbidity, Firsthand Accounts from American Women." And one of the things that the researchers found when they were putting together this white paper for us was that according to one study, more than 15% of maternal deaths within days of delivery occur in women who have experienced a stillbirth. In addition, African-American women are 2 times more likely to die during or after pregnancy than their white counterparts. So what Count the Kicks can do is help bridge that gap and help people notify if there is something going on, whether that's with mom or baby before. That's what the goal is, right? That's what the app does. It helps you get to know what's normal for your baby, because movement is one of the first things to change when something's going on with either baby or mom, like that, in that regards. So now we're going to jump into implementation of Count the Kicks, what you're all here for, right? So Grace, go ahead and talk about why movements matter.
Yes. Movement is one very important way that a baby communicates with us before birth. It's the primary way, usually the only way they have to communicate with us before birth. A change in a baby's movement can be an early sign, and sometimes the only warning sign that a baby may give when they are in distress. And then a baby during pregnancy is just like all of us. When we start feeling sick, we change our activity level. We might lay in bed instead of exercising or going to work. We slow down our movement to conserve energy. It says the baby's movements are the same way. They may become weaker during a time of distress. When a baby is not feeling well, they naturally preserve blood flow to vital organs like the brain and the heart to conserve energy and self-protect. This happened with my son, with my third baby. I'll tell you a little bit more about that. But he started slowing down and he stopped moving, and other things were okay. But that was the first warning sign that I had that something was wrong with him. And that's why it's so important, because it's an early sign. If there's a risk of stillbirth, you want to catch it early, because if it's late, it's too late. And so then there are 3 types of movement change. Baby either has fewer or no movements. They're slowing down. A baby might move, but the movements become softer or weaker, or there could be a sudden wild surge of movement. And this can be an important sign of distress. Caitlin and I actually met with a mother recently. We had met together in Oxford, and there was another mom, and she said she had lost a baby. The same thing. She said, I always remember this one huge big kick that I had, and then after that she had stopped moving, and it ended up that she ended up being a stillbirth, but she had that. So these are just, knowing what is your normal during that pregnancy is so important, because then if there's a big deviation from that, a mom can know to get that checked out.
Grace, can I pop in for just a second on that?
Yeah.
I just wanted to share. So I'm in obviously a lot of Facebook groups related to stillbirth. And so I see women every day joining our groups because their baby has died. And I hear these in pretty equal amounts. So either they'll report my baby wasn't moving as much the last week or two, or they might report all of a sudden my baby just wasn't moving. And that's what happened to Carson, is he just didn't move one night at his normal active time. But they will sometimes report this wild surge of movement. They'll describe it as frantic, or like it hurts them because it's so strong and so urgent feeling. So I just wanted to chime in and say that from the stillbirth moms that I have heard from, like these 3 come in pretty equal amounts.
Mm-hmm. Yeah. And I'll just add, this is what research shows too, right? Like we know that not all stillbirths are preventable, but the ones that potentially are preventable, these are the types of movements that we want to be aware of. And this is why it's so important to know what, like Grace said, your baby's normal movement pattern. That's really key.
So the next slide. Since kicks matters, let's start counting. And when should a mom start counting kicks? At 28 weeks gestation or 26 weeks if they are considered high risk. I am a doula and childbirth educator. And when I start my class and I talk about count the kicks in the first class, I tell them, I say, everybody get out your phone, go to where the date in the future where you're going to be 28 weeks and put a reminder in there that says, start counting the kicks. And I was like, download the app so you know what to do. But so on that day when you're 28 weeks, it'll pop up and you'll start counting kicks then. And so the 28 weeks and 26 weeks for high risk is when research indicates that baby has established a consistent pattern that mom can feel and track. And what counts as a kick, a roll, kicks, jabs, anything except hiccups, because these are involuntary movements. And then how to count the kicks to be in tune with your baby. The first one is just get the free Count the Kicks app or the paper counting, the free paper chart that we talked about, and count the movements every day, preferably at the same time. And so it doesn't have to be like, when we say the same time, like it might be like in the evening after dinner, because that's when baby starts getting active. It doesn't necessarily have to be at 8 o'clock every single day. You can say, okay, this is after dinner. I feel baby starting to get active. I'm going to sit down and count. I had some moms who do it. They say, when I get to work and sit down at my desk, baby starts moving. So I've just kind of made it in the morning when I first start work. That's when I'm going to do my kicks. So kind of, again, noticing what is your baby's normal movement, their normal pattern of movement, and going off of that. And then time how long it takes your baby to get 10 movements, and the app will help you do this. Like I said, I have a 2-month-old. I counted her kicks, and it was so easy to use. You just open up the app either on phone, or you can even do it on an Apple Watch, and just press the little foot every time they kick, and when it gets to 10, it'll record it. And so after a few days, you'll begin to see a pattern for your baby and the average amount of time it takes to get to 10 kicks, and continue to track every day. Call your provider right away if you notice a change in how long it takes your baby to get to 10 movements. Or I've told moms, if they're very concerned, you can just, go to L&D, go to triage and let them know. And we just call and make sure you get it checked out if you're concerned that your baby's movement has changed.
Okay, so let's talk about the app. So the app is free. It is evidence-based, as the whole campaign is. And it's been downloaded nearly 200,000 times in over 140 countries. So that's crazy, but great. And it's also available in 14 languages. You can see the list there. Again, like Megan said, if there's a language that we need in Mississippi, please let Count the Kicks team know, and they will work on that. It is available for both Apple and Android. And like Grace said, you can even use it on the Apple Watch, which is really nice. And you can see in the upper right, there's just some snapshots of what it looks like, what the app looks like when you open it. Important points about the app. So a user can restart their session, sometimes, especially if it's not your first baby, you may have other ones, other little people around, and you may get distracted or busy, or somebody needs a snack all of a sudden. So they can restart their session or delete a kick. My children would be likely to just get on there and go crazy, so I'd have to delete some kicks. You can set a daily reminder to count the kicks, which is really helpful. And in the video at the beginning with baby Ruby, I think that's what Emily was mentioning, was that it can set a reminder so that it'll notify you that, hey, it's time to count your kicks. You can review your kick counting history, and you can download that history to share with the provider or with family or friends. But that's what I'm talking about when I say it gives you a common language. It's going to give you, as a provider and your patient, a common language and concrete data that you can look at to talk about how baby is doing. Another fun aspect of the app that's really valuable is that you can do this for twins. So we know that twins are usually considered a high-risk pregnancy. You can count kicks for both twins with Count the Kicks app. And then another just kind of like fun aspect is that a user can create one profile and they can track future pregnancies on the same profile, which is just kind of fun to like build that familial bond. You can manage multiple devices registered to your account, and then again, it's available on the Apple Watch. I think that pretty much covers it. So it's a great app, and it's very user friendly.
Yeah. And I'll just add, Caitlin, too, for you all. This is a perfect time to go, because I know we can all multitask. Go to your app store right now and search for Count the Kicks and download it, because we want you to use it so you can go to your patients, your clients, and say, look how easy this is. Let's make sure you set up a profile before you leave my office today. So become familiar with it, so you can use it with the people that you serve.
And I'll add to that too. My sister is a labor and delivery nurse, and she has found out about the app after she'd had her last baby. So she's never used it during pregnancy, but she has it on her phone. And whenever she's discharging a patient who might have come in for monitoring, or, for something, who's still pregnant, when she's discharging the patient, she gets out her phone and shows them the app and does a little demo of how to use the app and how to count. And it's like, get your phone and let's download this and let's do it. And teaches them through the app so that they know when they go home how to use the app. So it's very user friendly and easy to do.
Yeah, that's awesome.
Okay, so this is strength tracking, which is a newer feature of the app, but it's really important and really I don't know, it makes me warm and fuzzy because I think it's such a good aspect of it. But if you'll remember back to the video with baby Ruby, her mom talked about her movements getting weaker. So this is a way to track that. Just like you're counting the pattern of the movements, this is an option to track the strength of the movements. So you'll see the different screenshots here where it will actually describe to the user how to judge the strength of the movement. So level 1 is fluttery. That might be sort of like what you felt when you first started to feel movement. Level 5 is fierce. So that might be something that you can actually see the kick from the outside. And then you can kind of judge what a 2, 3, 4 might be. But then you'll see also that they can, at the end of each session, they can log the strength of the session, and they can also put in a note. So there the note says baby felt strong like normal. Maybe the note will be baby was a little bit weaker today than yesterday, or this is the second session that baby's not quite where they normally are. So all of those things are going to help the pregnant person to kind of make some mental notes about things that they want to discuss with you, or to immediately understand like, oh, something's not right. Let me go to L&D, like Grace said. So this is the how to track the strength and why that is so important.
Yeah. And I'll just add too, like Caitlin and Grace have both said, this is very visual, right? So you can see on that last image there where the top section is how long it took baby to get to 10 movements, and the bottom is that strength. So in this example, you can see baby was pretty linear, right? Like it was pretty consistent. And then all of a sudden that top graph shot up and the bottom graph, the strength decreased. And so I'm not saying that these have to coincide at all. What I'm saying is this shows how visual the app is. So that can be assigned to mom to trigger to say, that's not my baby's normal. My baby's normal for the last 5 days has been, pretty regular, pretty around 4 or 5 strength, and movement's been pretty the same. And all of a sudden it's changed. I need to talk to my provider. I need to go into my provider's office, see what they want me to do, and go to the next step. So that's just an example, but I really want to showcase how visual this is and user-friendly it is.
So a little bit more on the visual and user-friendly. The app also has video capabilities. So if you have someone who maybe isn't a strong reader, or maybe they just are a visual person, a visual learner, there are videos within the app that kind of describe how to use it and the importance. And so there are tutorials on how to use different features. And so it's good for you to demonstrate to your patients how the app works, but you don't have to feel like they're gonna have to call you back with questions. You can, let them know that there are videos. So if they get home and they forget what you showed them, there are videos easily accessible to kind of refresh their memory and make sure that they feel comfortable with how to use the app.
And as a mom who's used this, and as a mom who as a childbirth educator who gives this to my students, I can tell you it's very intuitive and it's very user friendly. I've never had a mom say, I don't know how to use this, or this is too hard, or I can't figure it out. They've all been able to figure it out pretty quickly.
Yeah. And I know we're answering questions at the end, but I do want to address this one that Michelle just asked. She said, you mentioned removing kicks, et cetera. Can you count and log multiple times a day? And so to answer that question, yes, you can. But I would recommend, if you are working with somebody and they want to count morning, noon, and evening, I would recommend they set up a different profile for each one, because otherwise their pattern is going to change, because it might be totally different in the morning than how your baby moves, what their normal is at night. So making sure that they set up like an AM, afternoon, and evening or something like that when they go to set up. You can set up multiple pregnancy profiles is what it's called on the app. So have them just set up that so they can track each session. So then they get to know what's normal for my baby in the morning, what's normal for my baby in the afternoon, what's normal for my baby in the evening, that type of thing. So hopefully that helps answer your question.
I want to piggyback on that, Megan, just for a second. There's a slide later in the presentation about talking to moms who've had a previous stillbirth, but this is really valuable information for especially those moms, because when I said that like you couldn't have quelled my anxiety with my third pregnancy, this actually, if I had known that I could do that, that would have really been something that I would have hopped on, because I was like very obsessed with like monitoring at different times throughout the day. And so I think that's a really valuable tool for any mom, but especially if you have a mom who does have a higher level of anxiety due to a previous loss, being able to track throughout the day and telling her how to do that in a way that isn't going to mess up the data and is going to demonstrate the accurate pattern, that is really important.
Yes. Yep.
Okay, so this is just another aspect of the app. There is a resource within the app that allows them to find free and reduced cost services they need. So maybe they're looking for housing, maybe they're looking for a local doula or a food bank. They can go into this aspect. So in the app on the menu, you'll see able to access this website, healthybirthday.findhelp.com, and then they can just put in their zip code. And I've tried this for Oxford and it works, and I was amazed. And it pulls up a huge list of available resources close by. So that's also available through the app.
Yeah, and there was another question that I just answered where you can actually download your data on the app and share it with your provider. So a lot of times they'll download it, they'll share it to like a My Chart, or they'll take a screenshot of it, or they'll print it out and take it to their appointment. So there's a lot of ways to bridge that gap between provider and mom. And that's what I think Caitlin was saying earlier, where it's like that data download, right? That data in the mom's hands to say, hey, this is my baby's normally, and today this is not normal. Like, we need to get this looked at, type of thing.
Yeah, because I can say that, like, with Carson, when he stopped moving, well, it's a long story, but anyway, the thing that would have been helpful with the app is having that data, because when I knew something was not right, it was just a feeling. But I think that if I had been tracking, if I had known about Count the Kicks and I had been tracking, I'm almost 100% certain that the data would have shown that he was slowing down. And then I would have been able to go to my provider and not just say, I feel like something's wrong, but I could have said, look at this chart, something's changed.
Yeah. Yeah. So great. Now we're going to share this quick video. This is on the app too, but this is what you can share with your expectant parents, and it walks you through how to use the app. So let's go ahead and watch.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
All right, so now that you know more about the app, let's look about how you can integrate this into your workflow. So again, remember, this is something that is really a passion project of mine, of how we can make this easy and systems level change. But also, did you know that health literacy is one of the strongest indicators of an individual's health status? And there are 5 ways to improve the conversation, and that's what Count the Kicks can help with. So being equitable, avoiding assumptions, and provide all expectant parents, no matter race, gender, religion, socioeconomic status, sexual orientation, marital status, or education level, the same information and interaction. Listen and learn, asking strategic and open-ended questions, which we'll share about that in a minute, about kick counting, and help you assess what the individual patient understands, feels, and desires. Being clear and concise. I cannot emphasize this one enough. Avoiding long or complex explanations and medical terminology. Consider everyday vocabulary. Also, be very clear. So if you have somebody coming in for an ultrasound for something else that you're monitoring, do not tell them things like, oh, you're good for another week, or we'll see you next week to check everything out. I've heard stories from fetal infant mortality reviews where they said their mom had an ultrasound that thought everything was good for 7 days because that's, when they do it. But what they didn't understand was that a change in fetal movement is an acute condition. It needs to be looked at and seen right away versus waiting. And by the time that mom went to that 7-day ultrasound again, it was too late. And so just making sure we're really cognizant of how and what we're saying, being honest. We'll talk about this here in a little bit about not wanting to scare moms. We're not delicate flowers, right? We hear all sorts of things during pregnancy. Stillbirth is another thing that we need to be talking to moms about. And then reteach. If patient displays confusion or a lack of understanding, make sure to correct and clarify, provide extra support. You should be talking about Count the Kicks every single time you see your patient or client in the 3rd trimester.
So we know and understand that talking about stillbirth is not something anyone wants to do, but it is so important. And we would much rather talk about stillbirth than have a mother experience stillbirth. Expectant moms hear about all sorts of things that can happen to their baby. We talk about the importance of taking your prenatal vitamins and taking folate supplements, of not drinking alcohol, etc. And so this conversation should be part of your routine exam with expectant moms. And so I don't want to scare moms, but pregnancy is full of risks that we talk to moms about. Stillbirth is another risk that moms deserve to be educated about. Stillbirth just happens. There's nothing we can do, but there are warning signs. And we know that research shows that if moms know what to look for, that babies can be saved. Her baby is always active. It's not a concern. And babies are active until they aren't. And cord and placental accidents can be sudden. Moms need to know what is normal so that they can notice a change. And she's almost at her due date, but the risk of stillbirth increases as a mom approaches or exceeds her due date.
Okay, so talking to moms who have had a stillbirth previously about fetal movement, right at the top, I'll say if you want more information about this, please feel free to email Megan or me because I'm happy to talk about it, but I'm going to hit the high points. So follow the same protocol. It's really important that you don't assume just because her last baby died that she knows about this, because I can say I didn't know about this. I had to find it out on my own doing research after Carson died. And when I had my 3rd pregnancy with Mason, no one talked to me. The duration of his pregnancy, no one talked to me about fetal movement, how to monitor it, strength, pattern, frequency. None of that was ever mentioned to me. So it's really important that you follow the same protocol with her that you would with any other woman. Read the chart prior to entering the patient room. That's just like, you should just do that with every patient, but especially with a mom who has had some really serious birth trauma. It is really helpful to us. We're trying really hard probably to keep ourselves together because we don't love falling apart at the drop of a hat, but it's really helpful if you read the chart before you enter the room. We understand you may have additional questions or you may want us to tell our story in our own words, but knowing as much as you can before you walk in is just really helpful in lifting some of that burden off of us. And then women who have had a stillbirth are more likely to experience another. I think the rate is we're twice as likely to have another stillbirth. And so talk to us about tracking baby's movement starting at 26 weeks versus 28 weeks. It is totally okay to talk about the previous stillbirth. Now, I will say every woman has their own preferences, but in the amount of women that I've spoken with who have gone through stillbirth and a baby dying, we want to talk about our babies. So ask their name, ask their gender, use their pronouns, use their name. We don't hear it enough, and it makes us feel really good. And then stay away from medical terms like fetal demise. I feel like that's an obvious one, but I can say that during my pregnancy with Mason, I had a doctor sit in a room with me and say fetal demise in relation to Carson. And it was jarring and it was upsetting. And so just, I know, that's your language and you might get caught up in that and it feels normal to you. But when you're talking to a mom, especially a mom who's gone through something like this, please be cognizant of that and don't use a term like fetal demise, stillborn, stillbirth. Some people like to say that they were born sleeping. Some women like myself, we're fine with like dead, dying, died. That's fine. So you can ask her preference also, but just don't use fetal demise. And then you should always ask if they've ever been talked to about the importance of tracking fetal movement before. I'm going to say that chances are good that they haven't, but you never know. And so it's good to ask. And I will say that a lot of moms that we talk to that have had previous live births have stated that they were never told about the importance of tracking fetal movement. That was true for me. My first pregnancy, no one ever talked to me about it. Second pregnancy with Carson, different provider, I was never spoken to about fetal movement.
Thank you. And I'll just add, I know we're getting close to the top of the hour. So just know we're going to go about 5 minutes over, but feel free to stay on because we still have a couple more slides to cover that I want to make sure you get to. So right now we're going to review some common myths, and then we'll go into the materials that you can order and things like that. So, but this is being recorded too. So Grace and Caitlin, take it away.
My baby is always active, so I don't need to count kicks.
So this is false. Even active babies, as we've said, can experience distress, sometimes quickly and without other warning signs. And that's what happened with Carson. He was fine until he wasn't. Tracking your baby's movement every day takes the guesswork out of knowing if a normally active baby has slowed down. Count the Kicks gives you real data to show your healthcare provider if you have a concern.
Only those experiencing a high-risk pregnancy should pay attention to their baby's movement.
So this is also false. All expectant women should be educated on Count the Kicks and get to know what's normal for their baby. And this one applies to Carson as well. We were not labeled high risk until he died. So yeah.
My baby should get 10 kicks in 2 hours.
This is also false. Every baby is different, and the recommendation to expect 10 kicks in 2 hours is outdated. Current research indicates moms should work to understand the normal amount of time each day it takes their baby to get to 10 movements each day. So we talk a lot about pattern. What is their normal pattern?
I can just use a Doppler device to monitor my baby's well-being.
You all probably know this, but the moms need to know that this is false. A change of the baby's heartbeat is one of the last things that occurs when a baby's in distress. A change in a baby's movement may indicate potential problems before actual changes in the heart rate are detected. I went to a normal appointment Friday morning. Carson's heartbeat was fine. I was sent home that night. He wasn't moving. And then the next morning he was dead. Oh, if baby isn't moving, I should drink cold water or eat something sugary to get them moving.
This is false. Research has moved away from the idea that sugary drinks and the like are a good way to get baby to move. Kick counts are best monitored without interventions like juice, candy, etc. If the baby isn't moving like normal, parents should speak up to their provider right away. And this was something I had heard. And when my son stopped moving, I tried to do these things, and I just shudder to think that, you know, the time that was lost while I was waiting when I should have gone in. And I'm so thankful that it didn't make it too late when I went in with my son.
Babies kick less near the end of pregnancy.
And this is also false because babies do not run out of room at the end of pregnancy. The types of movements may change. They might have more jabs and fewer rolls, but babies should move up to and even during labor. If an expectant parent is monitoring their baby's movements at the same time each day, it should take about the same amount of time to fill 10 movements up until the end of the pregnancy.
Pregnant people should avoid dental care.
This is false. Good dental health is always important, and pregnancy can increase an expectant parent's risk of dental issues, thus increasing their overall health issues.
Triage doesn't need any Count the Kicks education.
This is false because L&D triage is the perfect place to have this information. Posters, brochures, and discharge papers all should be used when someone comes in for anything and is sent home. And I will say this is also important because if someone calls into triage or calls into labor and delivery, they need to be told, come in right now, let's monitor the baby. They don't need to be told to do other things or to wait. Triage needs this information to know, get in here and let's check on the baby.
Exactly. So you could do things like add to your discharge paperwork. If they do come into triage and everything checks out great and they get sent home, we have documentation for that. Have all your front desk staff trained, include in your family care intake form. In Iowa, we have to take our glucose test in the clinic. That's a perfect opportunity to say, hey, drink this awesome drink, sit here for an hour, read this brochure, download the app, and we'll talk about it. EMR, EHRs, add to the phone recording about Count the Kicks. Electronic medical records, we have examples of this. Again, this is baby Margot. She was saved when her mom noticed brochures and posters all around her office. So we'll talk about how to order that here just in 1 second. So this is our gold standard after visit summary. So happy to share this with you all as well. If you want to reach out to me and we can make sure we get this into your EMR, EHR. It's really not difficult. We have partnership examples of how to integrate this into your workflow. We have childbirth lesson plans. So if you work with child or you're a childbirth educator, absolutely. We have these all on our website and you can reach out to me. So I know there's been some questions in here. Normally what I like to do is I love to play this Pharrell Williams song of Happy. But right now I want you to take your phone and scan the QR code or go to counttthekicks.org. Click on order materials and click on Mississippi and fill your shopping carts. If you order materials today during this webinar within the next hour, you will be entered to win another option to win a gift card. So go ahead, take some time. We have promo posters in English and Spanish. We have how-to posters. We have app reminder cards. We have brochures. I know a lot of you were asking. These are your tools. This is how you're going to share this with your patients and clients. So order this. It's completely free thanks to our partnership with the Mississippi Perinatal Care Collaborative and the Health Association, Public Health Association. We are so grateful for them. So absolutely take a few moments today, go in, order materials. And again, not only will you be getting awesome educational materials, evidence-based materials, but you'll also be entered to win a gift card. So take a few moments to do that. I'll also send it in the link as well. We also have an online CE training, 2.2 CEs. We just updated it to include a whole section on equity and inclusion. So I'll send this out. All of this will get sent out to you in a link after the webinar today or tomorrow. We have free resources. We have a parent academy that you can share with your expectant parents, provider academy, kick counting charts and videos. And then we have these lovely ladies here that are going to tell you more about their role as a Count the Kicks ambassador.
I am Grace Green. I'm in the Jackson area. I am a childbirth educator and doula. I have worked as a childbirth educator and a doula for about 9 years. I'm a mom of 4, and I knew some about kick counting. It's in some of the materials that I teach from. They say, baby's movement is the best way to monitor their, if there's a change, but I did not understand the importance of kick counting and monitoring, in a more than just a general, is baby moving well, until my 3rd baby, which is my son Reynolds. And I had gone in for my 40-week appointment and I had gone past my due date before and not had any issues. I hadn't had one single issue with any of my pregnancies, and, spontaneous labors, everything was great. And I had, gone in and I was, a few days past my due date, but I did a biophysical profile. Everything was fine. He immediately passed all the tests. Everything was great. My fluid level was good. And a few days later, I noticed his movement had decreased a little bit, but then he kind of got moving again in the day. And I kind of mentioned it to my husband, and I was like, just, pray that I'll go into labor, or if something is wrong, that I'll know. And again, I still shudder to think, why didn't I go in and get it checked out then? And then the next day, he absolutely was not moving at all. I couldn't get him to move. I couldn't count any movement. So I ended up going into labor and delivery. I called my doctor and she said, go into labor and delivery. I did. And thankfully I made it in time. His heart rate was great, but then they put me on the monitor. His heart rate was great. We went, but then they had a biophysical profile, and he had a 0 tone. I had no measurable fluid, and we moved quickly so that he could be born safely that day. And even some of the women I know on this call were involved in that as labor and delivery nurses or part of the staff at the hospital. And so from that, I learned more. I was like, why did this happen? Why did he stop counting? Why did he stop moving? And from searching, I found Count the Kicks, and then I started seeing some more stillbirth information about Mississippi. And I thought, this is something that other women need to know. And I want other women to know that if their baby stops moving, they need to go in, and this is important. And so, and I was like, were there warning signs I should have known about. And I think if I'd been using the app, I would have known that. And so I then contacted Count the Kicks about becoming an ambassador, because at that point there were no ambassadors in Mississippi, and I thought people here need to know about this. And so I signed on to be an ambassador in 2020 and have worked as an ambassador in conjunction with being a doula and a childbirth educator. And then I had my fourth baby in May, and I counted kicks with her. And I do feel like it helped me be more bonded to her. I definitely feel that, because I felt like, oh, I know her. I know her personality. I feel like every day I'm sitting down and spending time with her. And she was born, and I can say that as my fourth baby, when she was born, it was like, oh, here you are, and I know you, and this is who, and I really felt bonded to her in a way, like immediately, in a way that I didn't feel necessarily with the other ones. So that's a little bit about me. And again, I'm in Jackson. Go ahead, Caitlin.
Let me unmute. I'm Caitlin Ramage. I'm in Oxford, so I'm in the north half of the state. My background is in higher ed, so I don't really have any healthcare background, but I give presentations. So if you need something like that, you can hit me up. I have 3 boys. Carson is my middle boy. Hudson, my oldest, is 6. Carson would be 2. And then Mason, he just turned 1. So yeah, I'm just really I'm very grateful that you all are here. I'm grateful that you wanted to hear about this today. And I'm just really looking forward to how this is going to impact moms and babies like Carson and I in a way that I wish we had been impacted. So this is very meaningful for me, and I'm going to try not to cry, but yeah, I'm so glad that you all are here. I think this is going to be such a turning point for our state.
Yes, I agree. Thank you all for sharing that, Caitlin, and your stories. It's very powerful, and we hold you all in our hearts. I'm trying to get to the next slide. There we go. Oops, I missed one. The impact of our work, baby saves.
This is my son, Reynolds, and he's a little older now. He'll be 3 in August. And I shared his story, but I shared his birth story on the podcast, The Birth Hour, which has a huge following on social media. They have a lot of women who listen to it. And I shared his birth story, and there was a lady who listened to it, a mom who listened to it, and she, I think within days, saved her baby Clementine. She said she remembered listening to it and thought, wow, this is important, and downloaded the app and went to an appointment, and everything was checked out. And then the next day she realized baby's not moving right. And she went in, and she'd had, she'd had some pretty, she'd had some complications, some pretty serious complications that had happened really quickly. And baby was born by C-section. And the doctors even told her that if you had just waited later in the day, your baby would have passed away. This was it was a true emergency situation. And so I think sharing our story is important, and it helps. And you can even look up my birth story on the Birth Hour, and Clementine as well. Her mom shared her birth story on the Birth Hour, that podcast. And I also wrote a blog post for the Birth Hour. You can just go to the Birth Hour and search for my name, and you'll find that. I wrote a blog post about kick counting on their website.
Yeah, thank you for sharing that. So these wonderful ladies are available to do in-person presentations if it works in their schedule, more presentations like this. So feel free to reach out to us. I know we're over time, but we just have so much great information to share with you. And I do want to leave you with baby Nala. This is another baby save. She's from Iowa, and we do this. Why do we do this? We do this so we can save more babies like Clementine and Nala and all the babies. And we know there's so many out there that we don't know about. And so we thank you for this time. Let's go ahead and watch her story, if you don't mind hanging on for just a couple more.
She came back in after she had me put on the monitor and stuff, and she's like, we're just gonna take her. And I'm like, what? And she's like, her heart rate is dropping every time you have a contraction. I was already scared, because I was a high-risk pregnancy. Well, I basically learned from the doctor's office, the little yellow sign that was right there. Once she started moving, I was very alert with her movements, you know. That was what I lived for, just because I wanted her to, you know, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I mean, I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, you know, what if? Definitely to pay attention and count the kicks, you know. I feel like it's important just because had I not, you know, knew to do that, Nala wouldn't be here. Don't second guess yourself, don't feel bad or stupid, don't worry about insurance or the emergency room bill, go check on your baby, you know, because your baby might not be here. You just pay attention, you know, seriously, like, it's your baby's life.
I like what she says, where she says, go check on your baby. Don't worry about the emergency room bill. Don't worry about this. Go check on your baby. You can connect with us. We have social media. You can reshare our posts. You can sign up for our newsletters. So next steps, obviously become familiar with the app, which you already are since you downloaded it and you can use it. Order materials, which you already did because we're multitaskers here. This should take 3 to 5 minutes with your patient to educate on. So making sure you have the kick counting conversation with them every single time you see them in the third trimester, making sure your entire staff knows about this, share the recording with them. Talk to me about how to integrate this and use it in electronic health records, intake forms. Remember, hours and minutes matter. So if you work in a very rural area and they have a drive, make sure they know they don't need to wait for their clinic to open the next day. They need to get to their nearest birthing center because hours and minutes matter. And so thank you again to the Mississippi Perinatal Care Collaborative, the Mississippi Public Health Association. We are here in your great state because of you. We're so thankful and grateful that we get to save babies with you all. So I'm happy to stay on. We're happy to stay on for a couple more minutes and answer any additional questions you may have. You will get a recording of this. You'll get a PDF of the slides. You'll get a lot of links that we talked about. So we'll go there. Like I said, I'll stay on for a little bit. Feel free to use the Q&A, and just thank you so much for helping us with this and saving babies in your state. Thank you to Grace and Caitlin for being brave and sharing your stories with us, and your story, Caitlin. We're so grateful and the honor that you do for Carson. And we know that you're a great mom. And so we're so grateful. So thank you both to our wonderful Mississippi ambassadors. Thank you. Wait a minute or two.